Welcome to this Oncology Data Advisor interview. This week we have a special series in store for Women's Health Week, and we'll be posting a video every day featuring a different topic in women's health. Our second guest of the week is Dr. Gretchen McNally, who is a Hematology Nurse Practitioner at The Ohio State University James Cancer Hospital. She recently presented a poster at the Oncology Nursing Society Congress about reducing cervical cancer stigma, and today she's here to tell us some more about this work. Dr. McNally, thanks so much for coming on today.
Yeah, thank you so much for the invitation.
Absolutely. To start off, I'd like to introduce yourself and share a little bit about what you do.
Yeah, no problem. My name is Gretchen McNally. I'm a nurse practitioner scientist at the James Cancer Hospital, part of Ohio State. And my clinical background has really been working in hematology or lymphoma in an immunocompromised or deficient population, people with HIV, solid organ transplants. And because of that, and my population is pretty marginalized, I decided I wanted to go back and get my master's in public health. And during that, I was able to really specialize and become an expert in intersectional stigma. And for my final project, I was fortunate enough to work with the American Cancer Society National Roundtable on Cervical Cancer Stigma Work Group, which is how my interest in cervical cancer and stigma really started.
That's amazing. Looking forward to hearing some more about this work today. To start off, I'd like to tell us a little bit about what are some of the stigmas that are associated with cervical cancer in particular.
So cervical cancer is highly stigmatized, mainly due to its association with HPV, the human papilloma virus, which is considered a sexually transmitted illness and known to cause genital warts. So the association with the STI, with like a disease, an infectious disease, and then the stigma of sexual behavior in general.
So how do these stigmas pose a barrier to cervical cancer care, treatment, and patients' quality of life?
Yeah, so that's a great question. So, stigma really has been recognized as a major barrier to care across the entire cancer continuum, from prevention. So, specifically talking about cervical cancer, vaccination against HPV is highly stigmatized, and it is essentially preventable and curable. It should be eliminated. Cancer for a form of cancer. Um, Moving along the continuum, people, stigma prevents people from screening, early identification, or following up on their test results. And so that, of course, then leads to treatment delays or foregoing treatment altogether. And then that continues the side effects and the stigma associated with that continues into survivorship and then on from there.
Absolutely, a lot of barriers across the spectrum of care.
Yes.
So I'd like to tell us more about this work that you investigated and presented in your ONS poster.
Yeah, so for my final project for my master's in public health, I did what's called a white paper on cervical cancer and stigma. So I kind of did a little history of the American Cancer Society and the National Roundtable on Cervical Cancer. They had identified stigma as one of the top concerns from a survey in 2022, I think. And so I was looking for a project. My interest is in stigma, and so I started going to their meetings and meeting with them monthly and even in between those. And I did like a deep dive into cervical cancer stigma. I organized it by kind of past. So I started in 2010 to current, and then future was kind of my recommendation for moving forward. One way to battle or reduce stigma with cervical cancer. I used a guideline or a theoretical model called the Health, Stigma, and Discrimination Framework, which had been published in 2019. And interestingly, some other articles in cervical cancer stigma had used this framework to kind of classify the existing literature. So basically, the first HPV vaccine came out in 2006, and it was only for the prevention of genital warts. It didn't mention cancer at all, and it was only for females, which really doesn't make any sense. And then later, like maybe 2009, it was marketed to boys to prevent genital warts and girls only up to age 26. And so right there, this kind of link with a sexually transmitted illness really became well known in the public eye and in the media. It wasn't until later that HPV, the vaccine was linked to prevent, 7 different types of cancer, and the guidelines were extended up to age 45 for men and women, although earlier is better. And so the early studies kind of cemented that people with cervical cancer had more stigma towards them than other types of cancer, for example, ovarian cancer. And then the more current articles, um, they really focused on, they were mostly qualitative or descriptive. There was only one that used an intervention. They used an online intervention in England, and really they showed there that it was important to be careful about the messaging that you use, because people actually with cervical cancer were more stigmatized because of this messaging. So then when we get to my recommendations for the future, it was applying a universal precautions framework. Uh, and universal precautions really started back in the early 1980s with the HIV epidemic. Before then, people really didn't wear gloves. But starting with when HIV came around, you couldn't really tell anymore by looking at somebody who had an infectious disease and who did. So you wore gloves with everyone, and then that decreases the stigma because everyone is kind of treated the same. And so I, in my paper, said that I think that we should use this framework, the universal precautions kind of framework, along with language to start changing the words and the language that surround cervical cancer, because that really starts decreasing stigma at all levels, and really allows people to be more likely to present for preventative services, screening, all along that cancer continuum.
Amazing. Thanks so much for telling us about it. Sounds like a
Yeah.
really valuable resource covering, the challenges and stigma and moving on to, interventions that can help. So congrats on a successful project.
Thank you. Thank you.
Great. So what steps can be taken in the clinic to help reduce stigma? How can oncology nurses help?
So that's a great question. I think that as I had mentioned, just starting to incorporate clinical knowledge, non-stigmatizing knowledge or language into all of our conversations. Those that we're talking like with colleagues, peers, staff, our family and our friends, and just kind of start leading by example and educating through the use of language. HPV, while it is linked to causing genital warts, I think something like 90% of women have been exposed to HPV in their life. And so the majority of people are exposed to HPV. Certainly not all those people get genital warts. Not all those people get cervical cancer, but we should be able to eradicate cervical cancer in this lifetime with the HPV vaccine.
That's really amazing to hear. Do you have any resources regarding communication and language reducing stigma that viewers can reference, or any other advice for helping to do this?
Yeah, so there's all kinds of like sensitive language guidelines that are out there, but the ones that I really like myself are from the National Comprehensive Cancer Network, nccn.org, and they have language guidelines for culturally sensitive care, and they are like from anything related to cancer to like substance use to race, all kinds of, sexual identity, gender. And so I really like their guidelines. They give some great examples. And the one, but there are several out there in many different areas if you look.
Great to know. And we'll link to the NCCN guidelines and the interviews that
Yes,
are
that would be great.
great. So my last question as we wrap up today is since this week, the week of May 12th is Women's Health Week, are there any take-home messages regarding this work and women's health that you'd like to share?
Yes, the big one is that we can eliminate cervical cancer, as I mentioned before, through the HPV vaccine. And everyone should receive the HPV vaccine. It's really a cancer prevention vaccine. It prevents 7 types of cancer, as I mentioned, cervical, anal, head and neck cancers. And I always kind of like to tell this story. So I was too old to received the HPV vaccine before I turned 26. But then in 2018, when they raised the guidelines to 45, I could receive it. So I went to my local grocery store pharmacy and said, hey, can I get the HPV vaccine here? And they said, how old are you? And I told them I was probably 35 maybe. And they're like, no, it's only approved for people under 26. And I was like, oh, so that was just kind of funny. And I went to my women's health provider and I asked for it and they said yes, but I had to sign a piece of paper that, that I would pay for it if it wasn't covered by my insurance. But it was. I mean, it was literally right after the guidelines had changed. So I just think, and when I was telling a friend at a social gathering about this, debacle of trying to get this vaccine, they were like, well, why would you want that? Or why do you need that? And I was like, it's a cancer prevention vaccine. Yes, I'm married and in a monogamous relationship, but you never know. And I would rather, since I can get it than not get it. So that's just kind of, I think that everyone should consider it.
Absolutely. Important message to wrap up on.
Yes, yes.
So,
Thank you.
yes, thank you so much, Gretchen, for coming on today to share these messages with us and tell us all about your poster at ONS. It was wonderful to talk with you.
Yeah, great. Thank you. Thank you so much.